things we can do to improve our own and our family's health. Talking Health is a program of information and discussion by the Health Promotion Unit, aired every Wednesday from 3 p.m. So do tune into the very informative program dedicated to the promotion of positive good health in our community. Every Wednesday right here on ZJB Radio, and listeners can tune in every Sunday from 1:30 p.m. for a repeat of the program Talking Health. Remember that our community's health is everybody's business.
Insurance coverage is protection everyone should have. Call Jackie Ryan Enterprises 491-2055 or 491-7888 or email us at united@candw.ms. Inquire about insuring your home, your vehicle, your furniture. Ask about contract works, travel and liability. Our staff is accommodating and efficient and will work hard to make your coverage affordable. United's history of claim settlement is fast and very fair. Call or visit our office. You will like what you get. Get in touch with Jackie Ryan Enterprises or United Insurance at 491-2055 or 491-7888 or email united@candw.ms.
Good afternoon, Montserrat, and welcome to Talking Health. I'm Penny Maloney, the Health Promotion Coordinator, and as always, it's my pleasure to be here with you for another discussion about our health and wellness. And we know that our aim is to better not just our personal health, but of course the health of Montserrat as a nation. This afternoon, I have in the studio with me three very important officials from the Ministry of Health and Social Services, and their roles here this afternoon is to speak to us about the Ministry of Health's COVID-19 Vaccination Programme. Thank you for tuning into the program this afternoon. Those of you listening by ear, you also have the opportunity to view, if you wish, via television on ZJB's channel, or you can also tune in on Facebook or YouTube via the Government Information Unit. To the right of me this afternoon, I have Dr. Dorothea Hazel Blake, and she's no stranger to Talking Health, to the airways, but she's here this afternoon to lend her voice to COVID-19 vaccination. I also have to my immediate left Nurse Violet Brown. Everybody is familiar with her, I believe. This afternoon, she is here in her capacity as the expanded program on immunization manager. And further to my left, I have Dr. Mccassim, Dr. Brian Mccassim. He is our surgeon, and presently he is our acting chief medical officer. Good afternoon to my guests. Welcome to Talking Health. I will now hand the microphones over to you and allow you to say a word to our listeners and viewers this afternoon.
Okay, good afternoon, everyone. Good afternoon, Penny. It's good to be back on Talking Health to share the relevant information that we have. Stay tuned.
Good afternoon, everyone. It's good to be here this afternoon. I hope that we have an interesting conversation because we're here to share a lot of information. Thank you for having us, Penny.
Good afternoon to Montserrat and the listening public. We're happy here this afternoon to talk about vaccine. It's been a long time in coming, so we are finally here to give you the information that the Ministry of Health and the government of Montserrat has for you.
Yes, as Dr. Mccassim would have mentioned, it's been a while coming. People are so straight into my questions. And my first one is, which COVID-19 vaccine will we be getting here on island? There are quite a few of them out there in the public domain. Can you tell us a little bit of about the one that we'll be getting? What type of vaccine is it, and how does it work in very, basic layman's terms that everyone will be able to understand?
Want to take that? All right, let me take it. All right, we have so many vaccines and we've been hearing about so many of them. We have about 300 or so more in development. Finally, we got one that was sent to us by FCDO by the UK, and it's called the AstraZeneca/Oxford vaccine, which was developed in the UK. And this type of vaccine is the type which we call it's an attenuated virus, modified virus to stimulate your immune system. So that is the type that we are getting.
So you mentioned the word virus. Does that mean that it's a COVID virus that they are giving us to help stimulate our immune system?
They're not giving us COVID virus. They're giving us a virus called adenovirus, which has been genetically modified to make it non-virulent, meaning it wouldn't cause disease. But then there is a gene, an expression of one of the spikes, which is the S1, which would then stimulate your immune system, which is identical to the S antigen on the surface of the COVID virus. So when the body gets it, that is how it functions. It will stimulate your immune system with the first dose to make your body ready, so that if at some point in time you get the infection, the body will react effectively in defending the person who gets the infection.
Okay, so if I understand that correctly, just to summarize what you said, they took an adenovirus, which is a cold virus, a virus that would normally give us just a common cold, and they've modified it with a part of the coronavirus.
No.
To the protein.
A protein.
Yes, it has been genetically modified with a protein, which is it's an expression. One of the spikes. You've seen the pictures of the virus. So the spikes have different type of genetic coding, which gives it the name. So there's a specific one, which is the S gene, antigen, that has been worked into the adenovirus and cultivated. So it's non-virulent.
Which means that it cannot give us COVID-19.
It cannot give you a disease, but then it will still stimulate your immune system, although it's not going to give you a disease.
Okay, so it won't give us a disease. It stimulates our immune response. So then if we were to come into contact with the COVID-19 virus, our bodies would then know what to do.
Because, yes, the immune system works in this way. The immune system have something we call memory. So, and that is how vaccines are developed. So they develop and you simulate as if you got the infection. So the human immune system would develop some sort of defense against it. But then our immune systems have something we call memory. So if you get in touch with this condition again sometime in the future, it remembers that and say, okay, this is what I fought the last time. And because I have information about it, I'll just go ahead now and deal with it effectively.
Okay, so I think that was a good explanation for us, even those who don't have a medical background. We should be able to understand basically how the vaccine works. Anyone has anything to add?
I think, just so that people understand that is how, not just the COVID-19 vaccine, but vaccines in general. As Dr. Mccassim said, it works on the basis of memory. If you've been exposed to something, you know something already, and let's say you learn to drive. You've been accustomed, but you've only been accustomed to driving an automatic vehicle. And if you haven't driven one for a while, you go back into the vehicle, almost instinctively you know what to do, because your memory kicks in and says, oh yes, I've done this before. Similarly, because your body would have been introduced to the fragment that is incorporated into this vaccine, the next time your body encounters the COVID virus, as in now actually trying to give you an infection, it says, oh yes, I know this virus. This is what I did the last time, so I do it again, and so the response is much quicker, and you can result in a very mild infection, if any, or no infection.
No infection at all. Okay, anything to add, Nurse Brown? No. Okay, so we'll go to our next question. Those of you who would have been listening to public discussion and even in your own conversations with others as you go about, one of the key questions on everybody's mind is how many doses of this vaccine is Montserrat going to get? Can we vaccinate the whole population and, declare ourselves safe and be done with it? I don't know who wants to take that question. How many doses are we getting?
Let me take it. As we sit here, we're talking about AstraZeneca. The UK government has promised Montserrat, at least in the first instance, 3,000 doses.
3,000 doses,
Yes.
okay. And by my calculation, that is definitely not enough to vaccinate the entire population, considering we have a population of over 3,000.
Definitely not. But as you know, everybody, the whole world is looking, everybody wants vaccine. So we start, and that's why we use the term first instance.
Yes.
So you take it first, you have to look at uptake, and then based on needs, you have to require or you have to request if you need more.
If you need more. Okay. So in this first instance, what then is Montserrat's distribution plan? Is it a first come, first serve basis for the vaccine?
I think before we go there, there's an important thing to note. We're getting 3,000 doses.
But we have
But the
yes,
vaccination plan
It's
requires
two
everybody to be fully immunized to have 2 doses. So that means we have enough vaccines, assuming that they come through on the promise, for 1,500
people.
persons. That's first. Then now we can start talking about the vaccination plan, which I think Nurse Brown is better equipped to handle than I am.
Okay, the vaccine will be offered to priority groups. And when we say priority groups, we mean that persons such as those who are over 60 years of age, and that is the main priority group here because we are going to protect our elderly population. And we also will be looking at persons with chronic illness, which hypertensive, our diabetics, persons with asthma. Our frontline workers, so we look at our healthcare workers, and this includes the lookout warden supported apartments, so apart from those at the hospital, the lookout warden supported apartments, the workers there. Those at Golden Years and Mccassim Memorial Home, those have healthcare workers too, so we look at those. And then, if we have enough vaccines left, we can extend further to look at the police, the fire officers, and our defense force officers. We will be doing a registration system. We are going to start registering at the health centers, and if you're interested in the vaccines, you can call the health centers, any of the 4 health centers, and we'll give you the numbers. Salem Health Centers is 491-5256. St. Peter's Health Center is 491-5436. Cudgerhead Health Center, 491-5258, and the St. John's Health Center is 491-5218. And I guess as we go along in the program, we will be repeating the numbers so that you are sure of which number to call. And you have a choice of any one of those 4 numbers. Whichever one suits you best, then you can call that number and register. When you register, we are going to be asking you to give your name, your date of birth, your address, and a telephone number, simply because we would want to contact you so that we can give you your appointment. When you get your appointment, as you come, you'd get an appointment card. So it tells you get your first dose this time, then you're scheduled to come back for your second dose on this particular date. You'll be given a small card, which is like wallet size, and so you can keep it at all times. The registration system is not only for those persons that we deem as priority. We are going to open the registration to all persons. And so if you're interested in getting the vaccine, because I said priority, it doesn't mean that we are going to leave you out. If we have enough vaccines, we are going to extend the service to those persons who would have registered as priority as we go along.
And I imagine the registration, the registration would also inform as to how many doses you might need in another order?
Yes.
Yeah.
Right.
The registration is we're doing the call-in system that Ms. Brown just spoke about. At the ministry level, we're also trying to get a system set up, an electronic system set up. It's still ongoing. We're still in the initial, initial phases of trying to set it up. So there will be an online registration system as well.
Right, so that the health centers do not become overwhelmed, and it's easier and you can have the information more accessible when we start the online program. So we have several ways for you to register, but for starters, and you can start as soon as we are finished here. No, the health center will be closed, so we start from tomorrow. Right. So you can start registering at any of the 4 health centers, and somebody will take your information. And then as soon as we get the program, as soon as the vaccines are here, we can start calling persons and giving them the appointments. What I want to alert persons to is that if you're given an appointment, then you should keep your appointment. We are getting 10-dose vials. The 10-dose vials that when we open them, they should not be open any longer than for 6 hours. And at the end of 6 hours, and I see, well, you're not coming, then I may be able to fit in somebody else because we want to use the vaccines. They're in great demand, and so you wouldn't want to waste any. So please, if you can't come, if you're given an appointment and you can't come to keep your appointment, just call. Call and say, well, I would not be able to make it today, and then we'll give you another appointment to come. So that's basically it for the registration system that we're trying to roll out, so that we can be sure how many persons we have interested and look at how many doses that we have and to see if it's sufficient or if we need to order more.
Okay, yes. So
Yes.
persons register, and this includes the frontline categories that you would have
Everybody.
mentioned.
Everybody.
Yes, so
Registration is for everybody.
everybody, as long as you are interested in getting this vaccine, and the fact that persons have to register means that this is not a mandatory vaccine. It's of your own free will. You choose to take this vaccine. All right?
Yes.
That's correct.
Yes.
Whereas we've identified priority groups, it's important to say it's not mandatory for any group. We are cognizant of the fact that we will not have enough vaccines for 5,000 persons. I also know that 5,000 persons will not want the vaccine. But because we do not know just who wants the vaccine is why we are asking you call. You can register, so at short notice we will have an idea of which groups are interested, how many persons, and then we will, once that number has been identified, then we will then kick in the priority, because even if it's 2,000 people and we have 2,000 vaccines, it's the order so that you don't have chaos. You can't have, we're not supposed to be crowding, we're not supposed to be having too much people congregating in one place. So we also want to have it done in an orderly fashion. So we will be giving appointments so that you don't have, let's say 20 people want the vaccine today. You don't want all 20 persons turning up at St. John's Clinic at the same time.
Okay.
And in terms of the registration, persons may want to know if children can get the vaccine. So then, just to let you know, we are not. Okay, so then you don't need to register those persons.
So children, we're not registering any minors, no one under the age of 16. There are priority groups, 60 and up, frontline workers.
18 and up.
18 and up, sorry. And 60 years plus, you're a priority group. So if you're interested in having the vaccine, you call, you register, you will be first served. Frontline workers as well, you're asked to register, and anybody who would be interested in taking this vaccine, please call a health center of your choice and register, as well as look out for the online system whereby you can register, and hopefully that will be up and running shortly.
Yes, hopefully.
Yes. So you can look out for that shortly if you wish to register online. Okay, now one of the things that I can imagine will sway people as to whether or not they want to take this vaccine is the safety and efficacy of the vaccine. That's what people are concerned about. And we know that vaccine hesitancy is not something that's new. You get it with basically each new vaccine that comes out. Even the very first vaccine, the smallpox vaccine, if you were to research how the public reacted to it, everybody was afraid. There were articles in the newspaper, it would turn you into a cow and make you grow horns and a tail and whatnot.
Yes, hesitancy is not new.
This is absolutely normal. One of the things that to believe in the goodness of vaccines is when you see.
And this is not the only reason, but one of the reasons why they were able to. So when we got to 2019 and early 2020 and realized that SARS was bad, but the novel coronavirus was how many times worse, efforts were switched from developing from where they were with the SARS, but you didn't have to start at scratch. You didn't start at ground zero because initial work had been done. So they built on that work and continued. And for example, in this case, and just so you know, as I think he's encouraged by that because I know that it didn't happen overnight. Secondly, another thing that happened is that they ran some of the tests and the processes simultaneously. Usually to develop a vaccine, you have basically three very broad phases. Phase 1, phase 2, phase 3. And you usually have the luxury of running phase 1 and let that complete, do your analysis. Then based on that, then you go on to phase 2 and similarly then to phase 3. With this particular disease, we realize the significance of it, the complexity of it, and the rate at which it was knocking people down and the rate at which people were getting severely ill and dying. You realized you had to pick up the game. And so phase 1 and 2 were run almost at the same time. Shortly after you start phase 1, while monitoring phase 1, you moved into phase 2, so that the one phase that they could not or should not alter is phase 3, because that is the actual testing phase. And so that is why, again, the second reason why it was able to be shortened, the time between identification of this virus and development of a vaccine or several vaccines that the authorities are sufficiently comfortable to approve for preliminary use. So that's my long-winded way of saying that whereas the concerns about safety are important, and certainly you don't want to dismiss them, I am not as concerned as I could be had this not been the case. For instance, if they didn't have a head start with that coronavirus preliminary work on the vaccine, I too would have been a bit more concerned.
All right. So yes, just to add up a little bit to what Dr. Hazel just said, the phases were, as she said, compacted, we could say, but then you cannot roll anything out for public use without doing third phase. All right. And we're talking right now about AstraZeneca, and the third phase was actually done. They were done in 3 countries. They were done in the UK, in South Africa, and Brazil. All right. So based on the short time phase 3 testing, the governments and the authorities were confident enough to roll it out, because let's be very specific that this vaccine is coming out as something we call EUA, which is a emergency use approval. So that is the thing. The reason for it is because the third phase has not been extended enough to get some of the
all of the data that you would need.
You will need, right. So you could say this is an extension of the third phase to start getting some real information.
Okay. But so far, I can tell our listeners and viewers that over 20,000 persons have taken the vaccine to date. And those are persons that would have been enrolled in the trials, which would have started in April of last year. Over 20,000 persons have taken the vaccine. None of those persons were hospitalized from COVID-19, and none of them passed away from COVID-19. So that's important to note. It doesn't give you the virus, because we know that that's what everybody is concerned about. It also has not causes any horrible hasn't caused any horrible side effects leading to death that we know of thus far. So that is where we are. We're just giving you what the studies have been showing about this vaccine.
And it has to be highlighted that we are talking about one vaccine, because people get confused. We are only talking in this program
about the AstraZeneca vaccine. Yes, that is very, very important to note, because we do know that there are a lot of other drug companies who now have vaccines on the market as well. Okay, so the safety as it stands, we know the common side effects.
I was going to
Maybe
say,
somebody can tell us what those are.
Some of them are more common than others. There's the obvious ones like
injection
pain,
sites,
and some people get a lump at the site at which you got the injection. So if you got it in your arm, you will have pain in the arm, some more than others. Some people have mild flu-like symptoms. When I say flu, you might actually get a sore throat and a temperature. Think about even those of us who take our infants for vaccines.
Yes, that happens.
When the child gets a vaccine, most times, they end up a little bit fussy for the next 24 to 48 hours, because they're responding, and could be in this case, could be to the adenovirus that was included in the vaccine. Some people have nausea or bad feeling, and some people have complained of feeling tired. There are some a little bit less common. Some people complained of dizziness. Their head felt dizzy. They had a loss of appetite. Some people had enlarged lymph nodes, those what we call glands or nodes, which is just your body.
Your body's immune response.
Actually, it's good if you can sense that your nodes are working. It means that it is actually doing what it is supposed to do. And so a few people, less than 1 in 100 people, complained of itchy skin, or a couple of them actually had a rash. Those are the main side effects that have been identified thus far.
What about any rare and dangerous side effects? Were any identified in the course of the study of this vaccine thus far?
Thus far, the course of the study, nothing was reported. There was actually one was it my information? There was some question as to whether I believe in sharing all information, the good, the bad, the ugly. There was some conversation about whether there was some inflammation of the nervous system in 3 persons, in all those 20,000 persons. But and that is usually a severe reaction. So when that happened, the trials were actually suspended temporarily while they investigated to make sure that what was happening was not as a result of the vaccine. One person was found to have had a previous problem, a previous neurological problem. So there was no way to say that this reaction was caused whether by the condition they had before they took the vaccine or the vaccine itself. The second person did not receive the vaccine. They were part of the trial. In any trial for vaccine, you will have 2 groups of people. One group that you give the actual vaccine to, and another group that you give what's called a placebo, which is not the vaccine on the investigation. And then you compare and you observe them over time to see, are there any major differences between the 2 groups? So the second individual who developed this inflammation was not in the vaccine receipt group. That person had received the placebo. So again, you can't blame the vaccine for that. And there was a third individual. The information about that is still pending. They have not been able to confirm or deny. So it is quite possible that one person of that 20,000 has reported had a serious reaction.
And that's important to note, because with everything there's a risk.
There is a risk.
Yes, so you have to do your risk benefit analysis, which is really what I want from our listeners today. Do your own risk benefit analysis and then decide if you believe this vaccine is right for you. And based on the science at hand, you will either say yes or no and register your name if your answer is yes. I think this is a good point for us to go into a short break, and when we come back, we are going to continue to speak about this Oxford AstraZeneca COVID-19 vaccine.
There's a deadly virus right here among us. It's contagious, we must take it serious. It's impacting the way we live in, economically and socially. We must contain this pandemic. We must maintain, practice good health habits. Washing your hands is paramount. Touch your eyes, nose and mouth. Get rid of corona. Get rid of corona. Get rid of corona. Let's do this together. We need a vaccine for COVID-19. We need a vaccine for COVID-19. Get rid of corona. Get rid of corona. Get rid of corona. Let's do this together. We need a vaccine for COVID-19. We need a vaccine for COVID-19.
This has been a message from the Ministry of Health.
Jeffrey Wu, Shiloh, Lord Lake, and Talawa. We need a vaccine for COVID-19. We need a vaccine for COVID-19.
When a person does what is right and fair, it is called responsible. When a company does what is right and fair, it is called united. Your wealth includes your home, your furniture in a rental home, and your vehicle. Be diligent with your health. Protect your wealth. Shelter under United. Call Jackie Ryan Enterprises or United Insurance at 491-2055 or 491-7888. Or email us at united@candw.ms.
Welcome back to Talking Health. Once again, I'm Penny Maloney, the Health Promotion Coordinator, and we are here this afternoon talking COVID-19 vaccination. And I have in studio to assist with that conversation Dr. Brian Mccassim. He is our acting CMO, our expanded program and immunization manager, Nurse Violet Brown, and the Director of Primary Health Care, Dr. Dorothea Hazel Blake. And we had quite a lot to discuss in the first segment of the program. Just to remind our listeners that we are not only broadcasting via ZJB today, we are also on Channel 96 on Digicel Cable, and we are on YouTube and Facebook, the Government Information Unit's pages. We will be taking questions from the public as we near the end of the program. So if you do have a question, you can save it and we will let you know when to call our WhatsApp and give us those questions. The numbers to call for ZJB are 491-7227, 491-9064, or you can call and WhatsApp 496-2885. We also apparently have questions coming in on the live feed, and 2 questions here that I have been asked to forward to my guest this afternoon. The first question is, how many vaccines will Montserrat receive in the very first batch, which is coming in February? And the next question is, has a date in February been set? So for the rollout date, when the first vaccine will be given.
All right, let me take that. The message we got from FCDO through the governor stated the first week of February. There's no specific date.
So we have no specific date. All we know that we are
First
getting these
week of
vaccines the
February.
first week of February.
Yes, no specific date yet.
Yet. Okay. So we do know that we can rely on this team to come back with that information when it is available.
Definitely.
I
Okay.
can commit myself to say that as soon as the vaccines get here, if they get here the first week in February, I'm not sure which day, I am ready to roll the following Monday.
Yes, but I think the rollout would also depend on you, our listeners and viewers, because you're being asked to register. So if you do not register,
Start registering now.
you know, then
Tomorrow.
the
Yes, right now,
rollout date
tomorrow.
will be pushed back. So we're asking you to begin registration from tomorrow. And once you do that, then they can say, okay, well, the vaccines arrive, let's say today, Wednesday, February, whatever. We can start by next
Monday,
day,
the Monday.
if possible, or even the Monday. So please start your registration, and then we will be able to come back to you with a definite date when the vaccines have arrived on island and when the program will start. But we do know that it is February. Okay, so I'm just going through my questions here to see what is next. Yes, I mentioned efficacy of the vaccine. First of all, can we explain that word? What does efficacy mean? And tell us how efficacious is this vaccine? I don't know who wants to take that question.
I could take that
Yes.
because I got a question similar somewhere here. All right. We have some sort of mixed information in terms of efficacy. Efficacy means how effective is the vaccine. All right. So we just indicated that the studies are still very limited. Okay, so that information is limited to what studies have been done so far. And what has been done so far indicates that when you get the first dose, right, you can expect to have between 90 to 95 percent of efficacy. However, if we hear on the news that the UK is actually trying to delay the second dose. The reason for that is trying to answer the question I got is that they believe, although it wasn't part of the studies, they believe that coming from history and virology, if you expose somebody to the antigen, which I spoke about, the memory, and you expose it for a longer, you allow the first exposure to be longer enough, the body responds better before you put in the second exposure,
dose,
the
yeah.
second exposure. So the recommendation coming out of the study says you give the first dose, and it's recommended you get the second dose between 2 and 12 weeks. The British are saying they want to push it all the way to close to the 12 weeks because they believe that you're going to get
A better response.
response.
Okay.
Right.
So right now we are looking at what percentage efficacy?
Up to about 1995.
1995.
Yeah.
Okay.
That's very good.
And efficacy in this instance, I just want to point out, does not necessarily mean that you will not get
No.
the virus. What it means is that if you come into contact with the virus, I think Dr. Hazelblade would have mentioned this, if you come into contact with the virus, you will either have a very mild response or no response at all. That's correct? Okay, so just to make sure that we're on the same page there. I wanted to talk a little bit about herd immunity because I'm saying that now as a buzzword with this vaccine in particular. Well, COVID-19 vaccine, not necessarily the Oxford AstraZeneca one. How would herd immunity work in this circumstance? Let's say very few persons, sign up for this vaccine. Would it help us in any way, or do we definitely need to have those large numbers, taking this vaccine to show if it works?
The short answer is we're still not sure. And I get very concerned when people start throwing around herd immunity, because herd immunity is a very complex
Mechanism.
mechanism, for want of a better term.
Yeah.
So it sounds very easy because you can simplify it and you can say, if enough of us get, and some people are offended by it because you say herd, it makes it sound like animals. I think the basic concept is, if you reduce the number of persons in the group, so in this group of 5,000 of us who live on Montserrat, if you have never been infected by COVID-19, it means you're susceptible to COVID-19. It means you can catch this disease. And we must remember that since last year we've been saying, if people catch the disease, right, 80% more or less will have a mild disease. Somewhere between 15 and 16% will have what we're going to call a moderate but significant disease. And then the remaining 4 or so percent will have this severe disease. And the whole idea is we want to reduce the number of people in the first place who are even susceptible. So that it means, so if you've reduced that, whether by everybody already catching it and can't catch it again, or you vaccinate, then for the few people in the population who, one, either cannot take the vaccine, or two, object to the vaccine, it means then that the entire group, or quote unquote herd, is protected by the fact that enough of us are immunized. And that figure will vary depending on the disease we're talking about. Why I can't give an answer is that initially COVID-19, the novel coronavirus, they were suspecting certain things. And now we have variants, which we're now hearing are more easily spread from person to person. And infectivity, or the ability to spread from person to person, affects what figure you can put on your herd immunity. And so we honestly don't know. I'll give you an example. Something like measles. Measles is a disease that we don't see much in this part of the world. But for herd immunity with measles, you need over 98% of your population to be vaccinated because it is so easy to spread. Whereas you go to the other end and you have some diseases that if you have 85% of your population vaccinated, then you don't have to worry. This disease, I believe, with the original strain, we might have been looking at a lower number. But with the new variants, which have increased ability to spread from person to person, that figure starts rising.
Okay.
And so it's difficult to say what figure would give us that magical concept of herd immunity.
Okay, so I assume that as studies continue, we'll be able to get that information eventually. I do have a question, as you would have brought up variants. Is it known as yet if this this specific vaccine can be used against the variants? I know that they said, I've heard in other studies, it was not specific to the Oxford AstraZeneca, that once it has, once the variant has certain similar
Of the same proteins that we spoke
as this
about.
one, it would be effective, but I'm not sure for the
It was
Oxford
confirmed that
AstraZeneca.
it works at least against one. I honestly don't know whether because there was another one now recently identified.
Yes, excuse me. Initially, I did explain the method by which this vaccine was developed, and they're targeting the antigen S. So any one of them that come, the variation comes from the different spikes, but then if amongst whatever is there, even though there's a variation, if you have the antigen
have
S
the
on
S.
the surface, it
Would be effective, and we know so far
And-
that is effective against one
At
variant.
least one variant still has that S antigen,
Right.
so it will work against that.
Okay. I want to go back a little bit to adverse reactions. You would have mentioned this one significant event that happened during the vaccine trial. We know that just one significant event for a population as small as ours is a huge deal. So how are we preparing should somebody take this vaccine and have a rare complication?
Okay. The vaccines will be given in a controlled environment. That is why we're asking persons to register at the health centers, and so that we know how much persons we're expecting. All health centers will have a doctor present and nurses present, and that is why we are kind of gearing up for anything that will happen, because they are usually sometimes events supposedly attributed to vaccines or immunizations. We will ask persons to wait around a bit to see if they're having any reaction to the vaccine. When we're satisfied that it's okay for them to leave, then we'll allow them to go. Anyway, what we planned that we will be following up persons at home also. So we are going to get persons on board who will be giving you a call and say, Mrs. Maloney, how are you doing today? Anything happened to you overnight? Anything you're concerned about? And so we'll have that on board so that we can offer that to our clients, so that we ensure that we have a successful program. And we are going to even ask the clients if it's something that you're not sure of. Maybe you have a little dizziness, but you're not sure if it's something that is related to the food that you ate yesterday. Still call and let us know. And of course, we'll come and we'll follow you up and we'll ensure that you're okay. You may have a little fever. We may want to come and check your temperature and, see you. And then reassure you and give you advice.
So this is not one of those vaccines that you would be giving out, let's say, in the work screening program. You have to take this at the clinic in the
Yes.
presence of a doctor and a nurse.
Right.
That is a
So
preferred
it's not
option.
like giving like a vaccination campaign. We are going out in the field and we are coming to you. We are going to ask you to come to us.
Okay.
So there's a more controlled, as she said, more controlled
A
environment.
controlled environment. Okay, and I have one last question before I open up the airways and take some more questions from online. Actually, two. My first question, are there any categories of persons who cannot receive the vaccine? You would have mentioned no children under the age of 18. Are there any other exempt categories? For
Pregnant
example,
women.
pregnant people. Well, there you go.
It's not sufficiently studied among pregnant women, so for those who may be pregnant, we encourage you to wait after baby is born, and you're interested in the vaccine, then we can have that done in the next round.
What about persons with hypertension, diabetes?
No,
There is nothing that
there's
says-
nothing that says they cannot have
They
it.
cannot,
have
As a
it.
matter of fact, we encourage
Yeah,
people
yeah.
with those conditions because those are the groups that tend to have the most serious forms of illness if they contract COVID-19.
I know that some other vaccines were not studied in persons with allergies, and then they were given to persons with allergies, and there were reactions. So
This one specifies that the
persons with
content-
allergies?
Yeah, allergies with the content of the vaccine, the components. And there's a list of components which we can share, but they are all, sophisticated names. I don't think anybody uses those kind of stuff, but then they advise that if you have any side effect, if you have an allergy, I could mention some of them here. They say L-histidine hydrochloride, monohydrate. You realize all the names there? magnesium chloride hexahydrate, polysorbate 80, ethanol, sucrose, sodium chloride, disodium edited dehydrate, and water for injections. That is the component of the vaccine. So if any of these substances that have been mentioned, somebody has ever told you that you have allergies to any of these, then you can't have them.
Okay,
It's
and
not advisable to have it.
I recognize that the adverse event that they're investigating was a neurological disorder. So let's say I have a neurological disorder, pre-existing neurological disorder. Should I take the
It would be
vaccine?
advisable not to
Not
at this
to
time. So
at
something
this
like
time.
multiple sclerosis.
Right.
If you've been diagnosed with multiple sclerosis or any other neurological, and if you're not sure, ask your doctor. This thing you say I have, is it neurological? If the answer is yes, then it would be advisable not to take it at this time.
Okay, so our exempt
But the
categories.
diabetics, hypertensives, asthmatics, all these people, unless you have the allergies that Dr. Mccassim just described, there is nothing that says you cannot have the vaccine,
Okay,
other
so
than you deciding you don't want it.
Then there's something else which is medical, which is about fever. I think they were mentioning if you have too high fever, it's advisable to wait before you get it.
But I think that's the standard for
That's the
all
standard for-
vaccines.
yes.
Yeah, if you are sick at the time, you don't take it.
Right. So we're going to look at the vaccines as, each person reacts differently to vaccines. So some of the things that we're saying here, somebody may just walk away scotch-free, no reaction at all, and they're feeling fine. And those persons can be persons who can encourage others to come and get the vaccine. I think persons are actually waiting for the first persons to go, and then if nothing happens, then we are coming on board. Yes.
Okay, and before we go to the questions, my last question is, if I get vaccinated, can I then throw away my mask, throw away my hand sanitizers, give everybody a
The
big,
answer is
great,
no.
big hug?
The
Not
answer
yet.
is no, not yet.
Not yet.
Yes. Okay.
No,
And that is one of the more important messages to take away from this. Yes, the important message, you have to make a decision about whether you take the vaccine or not. That is your decision. But I also want people to understand from a public health point of view, having had the vaccine, even your 2 doses, does not
mean
mean that
That
you
you're not-
immediately stop wearing your mask, stop washing your hands, and, practicing good hygiene, because what the vaccine will do is protect you from getting severe or complicated COVID-19 infections. It's not a barrier, it's not a shield in front of your face.
You from having.
So remember, COVID-19 is still spread by droplets. So if I'm sitting next to you, Penny, and you have COVID-19 and you sneezed, or kept talking to me, it is quite possible that the droplets would end up inside my body. But if I am immune now as a result of my vaccine, I will not come down with that illness. My body will simply recognize it immediately and say, I know this virus, and destroy it so that I do not get sick. So, no, you cannot put away your mask.
Okay, and we have to remember that it's still very early days.
Early
So
days.
we have to, err on the side of caution.
One of the things I probably want us probably to discuss, or to add to what Dr. Blake says, is that some persons think that by taking the vaccine, they're free to travel. And so when they go in the airplane, they don't have to put on their mask, they can do anything, they can relax. And so that's one of the reasons why some persons are going forward to get the vaccine. So it's just to back up what Dr. Blake was saying about reasons why persons would want to take the vaccine.
Yes. Okay, so we aren't going to stop as yet. We're erring on the side of caution until we know more, until we also know how long immunity lasts, because there's also a possibility that after you get your 2 shots, you may need to get a yearly booster. We know that that's common with vaccines. For example, the tetanus one, we would have gotten tetanus straight up to our 20s and whatnot. So
And
it's still early
measles,
days,
yeah.
measles as well. We don't know how long your immunity status would last. So until the scientists figure all that out, we're still going to be cautious in our actions. I have a question here from online. How many vaccines can be administered in a day, and by extension, a week? Yes, they're asking that of Nurse Brown. And just to remind our listeners and viewers, as Nurse Brown gathers her thoughts, that if you do have a question, a comment, you can call 491-7227, 491-9064, and 496-2885. 5, and we're just going to leave the lines open for maybe 5-10 minutes if persons have anything pressing that they wish to ask.
All right, because we are going to be observing persons after they have been immunized, the process takes a little longer. If persons were just going to come and get the vaccine and just go, then we could immunize up to 100 persons per day. But because we'll be observing some persons and we don't want our waiting rooms to be too crowded, then we can say at least 50 persons per day. And when we look at it, because we're saying that the doctor should be present, we have doctor's clinic for 3 days at St. John's. Then we have doctor's clinic for 2 days, and we have two different doctors there. We have Dr. Valentine that's assigned to Salem and Cudgerhead, and then and St. Peter's. And then we have Dr. Skerritt, who's assigned to St. John's. She's at St. John's 3 days a week, Monday, Wednesday, and Thursdays. And so we have her present, and we can immunize about 50 persons per day as long as we get those numbers. And at the other clinics, which are smaller clinics, then maybe a lesser number. So the person wants me to say at least how much persons I can immunize per week.
If it's roughly 50 a day.
Maybe 50 a day. So
And you have to remember, too, as you just said, it can be happening at 2 clinics all at once. Because on Mondays, for instance, we have a doctor at St. John's and one at Cudgerhead.
Yes.
So we could be having immunization happening in
Both
both
places.
places. On Wednesdays, the same. So it's quite possible. And on Thursday as well, you could be having, it would not be St. It would be on Wednesday, it would be St. Peter's and St. John's.
St. John's, yes.
So if you can do 50 at St. John's and even 30 at another clinic, that will give the person an idea. They can do the math.
Definitely just 80 a day, but again, that depends on numbers. I do have another question here, and it says, how much of your population is under 18 years? How much are between 18 and 60? That information should be readily available, and based on the information, it should be very easy to have a good idea of how much vaccine is needed. But again, this person needs to remember that not everybody will want.
Exactly. We know,
the
I can tell
vaccine.
you that over 60, the 60 plus, the last population
20-something
estimate
percent.
is about 1,000, just over 1,026 or
About
something
20-something
like that.
percent.
Yeah.
20%, yeah.
We know what proportion of, it's on my computer here somewhere if I looked, but we have to be cognizant of the fact that you will have persons who will not want the vaccine. And so we're not procuring vaccines based on just that number.
Population numbers, no.
We're getting this 3,000 doses in the first instance. Based on the response we get in terms of people registering and actually coming forward for the vaccine, we will know that, okay, that's an overestimation or an underestimation. We absolutely don't know what the turnout
Yes.
is going to be.
Okay, so just to let that
But we will let the
person
public, keep the
know
public
that we do have the
data.
numbers.
We know what the population structure
Yes,
is.
we know what it is, but that is not that's not the only thing that you have to consider when buying vaccines. You actually need to know what the uptake will
And the
be.
shelf life, we can't
And
keep
shelf
them
life
for
again, things like
for
that.
long. And as Nurse Brown said, even when they come in little vials with 10 doses
10
in
doses.
each vial. And from the moment you open that
You have to
vial,
give all 10.
you have to be able to administer all 10 of those doses within 6 hours. Or you have to
So
throw
we'll encourage
it
persons
away.
register.
If you only vaccinated one person for that day, at the end of the day, when the 6 hours are up, you can't put the other 9 doses back in the fridge.
And that
for
would be
tomorrow.
9 doses that
You
would
have
have
to
wasted.
you have to dispose of that in the approved manner. So that's we're trying to avoid that as well.
Okay, so Nurse Brown, could you give us the telephone numbers one more time for persons who need
want
to
to
register?
register? Okay, for Salem, it's 491-5256. St. Peter's is 491-5436. Cudgerhead, 491-5258. And St. John's is 491-5218.
Okay, so you have the numbers right now. From tomorrow, you can begin to register. You can also look out, as Dr. Mccassim would have mentioned, for an online format of
Please
registering.
call the clinic. Please don't call me. I will not be able to register you.
Yes,
And I
so
don't think
Dr.
those ones
Hazel
will
Blake
register you
cannot
either.
register you.
All the numbers that you were given, the nurses and the health aides have been prepped. They have their little
Booklets?
sheet and the little sheet with the template, and they're ready to collect
register.
your information.
Okay, so I think we've exhausted our time. I do not see any more questions coming in and no callers on the line. That's correct. We do have a caller, it seems.
You do?
No callers on the line. So I'm just going to give my guests 1 minute. What are your final thoughts, your take-home message that you want our listeners to have this afternoon?
You want to start? Okay, I could start. I think it's important in anything you do to ask yourself, what is the aim of the program? And I want our listeners to understand that the aim of this COVID-19 vaccination program is to protect those who are most at risk from serious disease with COVID-19. That's the basis of what we're doing, right? It's not to do anything else other than to protect those who are most at risk. Now, there may be other things that, come off that. And so that is why the approach has been chosen. So you look for those who are most at risk, which are our senior citizens, then those who are exposed to a lot of people, so frontline workers, so whether it's the health, the police, the fire and rescue, immigration, we call them IBS, immigration, people who are integrated border security, realize these are persons who are in constant contact. So those who are most at risk of serious disease would be older persons. One. The second one, whereas then a younger demographic, if enough of us get sick, and I talked about that 4%, every now and again there's going to be one person, even young and healthy, who will come down with severe disease. So that is why we're taking that approach. And so we encourage those of us who have a concern about this condition, would like to have this form of
Apparently
protection.
We do have a call coming in now. Seems that we lost that call. I do, however, have two questions here coming in under the wire. Okay, your caller is back. Good afternoon. Welcome to Talking Health.
Hi, good afternoon. I just wanted to comment on something Dr. Mccassim said earlier with regard to the time period between when you take the first dose and when you take the second dose. I've been following this in the media for a while, especially in the UK media. And what Dr. Mccassim said, I think he should read some more, do some more investigation into it. Because what I got was that the reason why they were extending to the end of the period, the 12 weeks, for example, was because they wanted more people to get the first dose before they started to give people the second dose. So it didn't have anything to do with the efficacy or how the vaccine was working with a short period between the doses or a longer period. It was more the fact that they said that as soon as you get the first dose, there's some level of immunization. So therefore, give as many people the first dose before you start going to the second dose. So if you can just research that some more. Thank you.
All right, caller. You can get in touch with me, and I'll give you the information that I shared on this program, because I don't say things that I don't research. So if you want, I'll give you some more information about that. What you just said is one of the reasons, but then the reason why they are able to take that risk is because they went into the studies and they found out that they could take that risk because even though, and if you listen carefully when I made I gave you the explanation stating that it was not part of the studies, but coming out of the experience from virology, they were able to take that risk because they believed that if they extended, right, they could get more immunity. One of what you said was true because they wanted to give, and the reason why they made that decision to be able to do that and practically violating what the studies are actually stating is because of that. Is because they know that they could get, the people could respond better if they increase the interval of having the second dose, and at the same time, they will get opportunity to give vaccine to more people.
I have another caller coming in.
It's me again. I just wanted to say that I'm not disputing that, because that decision that they took in the UK would not necessarily be relevant for us because of the much smaller population, and in addition to that, the much smaller number of people who would actually be taking the vaccine. So extending the second dose out to 12 weeks is not the most relevant thing for us. That's the point I just wanted to make. It's not to dispute what he's saying. I'm saying the reason why they did it there is to vaccinate as many people as possible initially. And that might not be the best route for us to take.
Great caller. Thank you for your clarification there. Two other questions that I have. One is, what about children with underlying conditions, and why are children under 18 not able to take the vaccine, which I think was said it wasn't studied in children under the age of 18?
The studies that were done, children under 18 were not part of the group.
Right.
And because of that, they decided not to at least start at this moment because they were not part of the third phase studies that were done in Brazil, UK, and in South Africa.
Yeah, so children, you're being exempted simply because you have not been researched as well. We have another caller on the line.
Okay.
Hello, good afternoon.
Good afternoon. Welcome to Talking Health.
Yeah. Can I ask a question? Can Dr. Mccassim repeat the effectiveness of the Oxford vaccine that we should be getting?
The effectiveness?
Yeah.
We have two types of effectiveness. We have the effectiveness for the first dose between the time of a giving, and we have different groups of people who get different type of effectiveness. People with comorbidities, the effective rate of people with comorbidities was reported up to about 75%. And then people who didn't have comorbidities went all the way up to about 95%. And it was repeated when the second dose was given.
Okay, so because I was doing like the previous part, I've been following this for the past couple of weeks.
Right.
And the one that we're supposed to be getting.
Right. We are getting AstraZeneca. We are getting the AstraZeneca vaccine.
62 to 90%, while the others have a 95% rate. So I was wondering what is wrong? Something sounds wrong there. The other thing, before I'm gonna hang up in a while. The other thing is, in the news it said Turks and Caicos, Cayman, Bermuda, and
I didn't get the first part of your question. In the news, it said what?
It said that Bermuda, Turks and Caicos, Cayman, and St. Helena got the Pfizer vaccine.
Yes.
Okay. Now, it is saying now that Anguilla, Montserrat, and Tatola will be getting the Oxford.
Yes.
Now, the excuse that I'm hearing is just not making much sense. It's saying, we don't have storage, or we don't have, by the time it comes to Antigua, it's going to be in trouble to get over here. All kind of story I'm hearing. I just want to know some more clarity on what's happening. Because I don't think a freezer should stop us from getting the best product.
All right, let me get that clear. It's not that correct in terms of the fact that it's a freezer problem. There are more logistical issues, more technical issues that prevent some of us from getting it because there are so many stops that we have to do before the vaccine gets to Montserrat. Okay, so that is the first phase. Maybe in the future, if some of these things are ironed up properly, we could get whichever type of vaccine that is available. So I'll just leave it there. But there are technicalities about it. And some of them have to do with the several stops before it gets to Montserrat.
Okay, so one last question that I am seeing here, which I think was addressed by Nurse Brown. Can we free travel after this vaccine within 14 days, the person is asking?
What is free travel?
What does it mean?
Probably means
I'm a
that
bit
they can-
confused myself about
they
the
can
term free
because
travel.
One of a discussion I had, one of the things that they were asking, if they can travel without quarantining, and if they, when they get on the airplane, that they don't have to wear their mask because they've been immunized, and so they're free, they've been protected against the vaccine.
I think Dr.
I do know that
Hazel
some islands, though, some destinations, they are decreasing quarantine if you are vaccinated. So it would
that
depend a lot
information-
on your destination,
That
wouldn't
information
it?
has not gotten to us officially.
Right. It would
Right.
depend on the person's destination and what are the protocols there.
Okay, so let me do this. We do most of our COVID related management with the advice of PHE, which is Public Health England. So we do have meetings every Friday. So there's a lot of information that is shared through that type of communication. As we speak, the last meeting we had was Friday gone, and that information has not been relayed anywhere. So if we get that information, we will share.
Okay.
Can I just say though, since the question has been asked, until at the end of the day, the decision to reduce your requirement to be quarantined or your requirements to enter any country is dependent on the government of that country. And on Montserrat, that is dependent on the cabinet. My recommendation to cabinet would be, despite the fact that people start getting the vaccines, the requirement for quarantine has to continue for a while yet.
Until we know more.
There are several factors that need to be considered. So, as I said, not my decision, it's a cabinet decision. But my professional advice would be continue and the full quarantine period until we have more answers, if we want to protect the resident population.
And you even have to consider the variants, for example.
Well, I was trying not to say that.
As more and more variants come and you're still they're still investigating how effective the vaccine is
It's
against these
a
variants.
because you
It
may
will be-
turn up here and you have a negative COVID test and you've been vaccinated, but you've been vaccinated against the original virus, and you've been tested in most countries only for that original virus. So that negative test, yes, it's a perfectly good test, but it's about that original virus that was identified in 2019. But you come with one of the variants that was recognized in 2020, which is easier to spread. Next thing, we have a full-blown outbreak on island. We're not ready to release, to reduce any quarantine or travel restrictions at this point in time.
So I hope that answers that person's questions. So I do not have any further questions here coming in. There are no callers on the line. So at this point in time, we're just going to wrap up. Dr.
forgot what I was
Hazel, she did start her conclusion, but we'll continue on with Nurse Brown and Dr. Mccassim, and then come back to Dr. Hazelbeck if she has anything to add, and then we'll call it a day from Talking Health.
She appears to have finished.
Well, I can say as EPI manager and the person responsible for the immunization program, I can tell the public that vaccine decreases your risk of getting the disease. And so I'm encouraging you to register and to come forward to get the vaccine. Last year, when COVID came on stream in Montserrat, we were all scared. And I'm telling you, we don't want to go down that route again. I am so happy when we don't have any COVID disease on island. And so I would want us to continue that way, and I would want to just encourage people, use the telephone numbers that I would have given to you before, call and register for the vaccine. Vaccine saves lives, and it protects the community.
And it's free.
Oh, yes, and it's free. And it's 2 doses.
All right. All I have to say is, as I started, this information was long due. People wanted to know what the ministry was doing. Anywhere you pass, people wanted to know what government of Montserrat is doing about vaccine. We're not getting the vaccine in Montserrat. So finally, we are here today, and we're breaking the ice today with the education, information. So primary health care is going to continue. Ms. Maloney is going to bombard you on the news, on the media, with all sort of information about education and all the other information. As they become available, we'll continue to share. Just bear in mind that not much is known yet about most of these vaccines. So we all don't know much about it, and we are all learning. We are in the learning process. So as we get more information, as more become available, we will continue to share with the public. Thank you.
Yes, thank you for coming and having this conversation with me this afternoon. And as Dr. Mccassim says, you will be back, and I'm looking forward to the new information that you will share the next time you come. Thank you to our listeners and viewers this afternoon. Also to our sponsor, United Insurance. It's been my pleasure. Also, thank you to the ZJB team. This was our first real live broadcast. You know, and it was very
GIU.
special. GIU. Thank you to the GIU team for making that happen. And I will see you again next week. And with that, goodbye from Talking Health for this afternoon.
Thank you.
Thank you.
Do you own a home? Furniture in a rental home? Have you got a business or stock in rental premises? Do you own a vehicle? Congratulations! It's all part of your wealth. You've earned it. Protect it. Shelter under United. United Insurance has the best record for fair and fast settlements. Call us today at 491-2055 or 491-7888. Or email us at united@candw.ms.
Are you interested in keeping healthy? There are lots of things we can do to improve our own and our family's health. Talking Health is a program of information and discussion by the Health Promotion Unit, aired every Wednesday from 3 p.m. So do tune into the very informative program dedicated to the promotion of positive good health in our community. Every Wednesday right here on ZJB Radio, and listeners can tune in every Sunday from 1:30 p.m. for a repeat of the program Talking Health. Remember that our community's health is everybody's business.